you are dealing with back pain, neck pain, or any pain along your spine, have a history of spine pain, or are looking to keep a healthy neck and back, then this podcast episode or YouTube video is for you, because I brought Sarah, who is a doctor of physical therapy, and she's here locally in Utah. So she knows all about adventure and helps people get back to their mountain activities or whatever adventure they are looking for. Now, the reason I wanted to bring her on is because here at Keep the Adventure Alive, we're all about bringing hope and the idea of what is possible if you are dealing with pain. So today we are going to talk about some myths around back pain, some common symptoms, and what is possible even if you've been told you have sort of back issue when it comes to your discs or are dealing with pain down your leg, whatever it is. We are going to talk about how to make adventure possible. So Sarah, if you could just tell us a little bit more about you, and then we'll get right into it.
Awesome. Thank you so much for having me. My name is Sarah, and I am a physical therapist in Salt Lake. I have a clinic here that I own, Pinion PT, and my practice is predominantly two groups of people. So one is people who have back pain, neck pain, and chronic pain. And then the second is people who are trying to get back to their mountain athlete endeavors. So I treat professional athletes, recreational athletes, you name it. If you are playing out in our mountains, I can treat you. The beginning of my career was spent in a spine clinic. And so I spent 4 years treating all kinds of back pain. I saw people directly from the emergency room. I saw people post-op. I saw people who've had chronic pain for 10 years. I've kind of seen it all. And the good news is people get better. That is a really big misnomer in the back pain community, where people think, oh, I have back pain, I'm going to live with this forever. But I'm here to tell you that that is inaccurate.
Yes, and I think that is extremely important, because I think empowerment is a huge part of just any chronic pain, whether you're dealing with back pain, knee pain, hip pain. Knowing what's possible and knowing that relief is achievable is kind of one of the biggest motivators when it comes to seeking out help. And kind of delving right into spine pain, so neck pain or back pain, what are some of maybe the common risk factors that make people more susceptible to this type of chronic or this type of spine pain that can really start to be really debilitating when it gets a little out of control?
Yeah, good question. So the interesting thing about back pain is back pain just doesn't happen from one thing. Back pain is multifactorial. So there's going to be a lot of things that can both positively and negatively influence your experience with back pain. We're talking belief systems, sleep, nervous system irritation, stress, diet, your previous history of back pain. So one of the big ones is if you've had back pain prior, you're more likely to have a future episode. That's something that the research really does support at this point. Lots of times people think it's only because they're weak, or it's only because they have a sedentary job, or it's only because of this. And back pain is a little bit more complicated than that. And there's a lot of things that play a role, which is nice in some ways, because there's a lot of things that can improve your back pain as well, and your back pain experience.
I think that's also an important point, one, because similarly to osteoarthritis of the knee or hip, there are a lot of other things at play when it comes to pain, which is why sometimes, like if people have surgery, so say like a lumbar fusion or a laminectomy or some other common surgeries, when you get those surgeries, it doesn't particularly guarantee that you're going to find pain relief. And so one of the most important things is to really kind of understand that there are some conservative options for this. And as far as back pain goes, maybe what are some of the common symptoms that you notice, whether it is back or neck, some of the common symptoms that people come to you with that then are able to find relief?
Yeah. So the the big things when we look at like who's going to be a potential responder for PT are, one, if you're absent of red flags. So if you have significant changes in bowel or bladder function, if you have numbness and tingling in your groin region, if you have significant loss of strength, you are not a good candidate for physical therapy. A physical therapist will screen out any red flag scenarios and then send you to someone who can deal with those. So those are kind of our big red flags for some of the back pain. If you came into my clinic and you had those, I would recommend that you go to the emergency room.
Are there any for neck pain?
Yeah, so neck pain, a history of trauma can be an indication that we would maybe send you out for imaging. So if you've had a car accident and you can't turn your neck a certain degree of motion, and that car accident was happening at a certain speed, there's more likelihood that you have a fracture, and we'd want to get imaging to rule that out before we would proceed with any conservative care. Other big red flags for neck pain would be big changes in like vision, dizziness, nausea, things that might indicate that something else was at play there. That's maybe not an appropriate thing for a conservative care provider to be dealing with.
Sure. And that's also good news, because if you're not experiencing these symptoms, what are some of the common symptoms that we can help?
Yep. So absent of red flags, the good news is most people actually have good prognosis for back pain and neck pain. So if you have more local pain, so if you only have pain in your neck or you only have pain in your back, oftentimes that gives us a little faster trajectory to decreased pain and resolution of symptoms. But having radiating symptoms, so in the low back world, kind of that classic sciatica or symptoms that go down your leg, down into your foot, down into your buttock, having those are still very treatable. What we would want to see though is that we clear up those distal symptoms first and kind of work on what's called centralization. So if you have symptoms that are going down your leg or down your arm, it's important for us to take care of those first, because those are often related to your spine. We want to make sure that we resolve those and then resolve the more local pain. So if we can change your peripheral symptoms or move your symptoms kind of towards your spine within a visit or two, you have a really great prognosis that will get better and get better quickly.
That's awesome. And I get a lot of questions about sciatica in particular. And there can be maybe some myths around sciatica, but then also there are some treatment options and people are able to get better. And so what would you say maybe is one of the myths or one of the things that you talk to primarily with people that are dealing with sciatica or just dealing with nerve pain down their leg, to kind of understand and maybe how to treat it essentially on a very basic level?
Yeah. So nerve pain are symptoms that refer down into your leg. They are often exacerbated by movement of your spine. So when we have spine pain, we often will see what's called a directional preference, meaning movement in one direction is going to be more beneficial than movement in other directions. We know for spine pain, one of the things that helps is to get you moving, right? Across the board, if we can get you moving, you're probably going to feel a little bit better. But we also know, kind of like the arthritis world, that not all movement is created equally. And sometimes you need a little bit of more of something and a little less of something. So with sciatica in particular, one of the things that we can see that will alleviate the tension of the nerve is to get your back moving a little bit differently. So when someone comes into my clinic and they have leg symptoms, nerve symptoms, I'm going to be screening for a movement pattern that decreases the tension or the irritation in their nerve, something that's going to take off the pressure of that nerve. And sometimes that's moving you kind of in a forwards direction or moving you in a backwards direction. And once we find that, then we want to have you keep moving into that direction a lot so that we can clear up whatever is restricting or irritating that nerve.
Which that can explain also why just doing like a figure 4 stretch or like stretching the piriformis is what's kind of out there. If you do a Google search of how to, get rid of sciatica, it can, I know that it definitely is one of the it has a higher risk for returning. Like if you've had it once, then it likely can return. But it's more than just doing specific stretches, and it's more than just doing, moving your leg in one way so you can get rid of the symptoms. So what you're saying is it's definitely important to figure out kind of what exacerbates those symptoms, like which movements exacerbate those, and then kind of moving almost in somewhat of an opposite way to kind of help relieve some of those nerve symptoms.
Yes, exactly. And I think one of the reasons why this is hard for sometimes people to figure out on their own is because when you have back pain, it's kind of scary to move, right? You don't know what's going to set it off. You don't know why you had it. And so one of the advantages of getting help from a physical therapist, if you can't kind of figure this out on your own, is they can safely take you through different movements and help you identify, okay, this pain is okay pain. This pain is pain that's telling us something different. And so I think in general, across the board, when people are dealing with pain, it's good to know that not all pain is created equally. Some pain is telling us, we've got to back off. We need to listen to this. This is like an alarm system. Another pain is maybe just saying like, hey, this is a little tight, or this is restricted, or maybe this is a movement we don't do a whole lot of. And I think you probably see that a ton with your arthritis population too, where there's going to be some symptoms, and those symptoms are going to tell us different things.
Yeah. And I think it's absolutely important too, because I always kind of talk about creating kind of a different relationship with your pain, that it's not all negative, and that it's just kind of our body's way of telling us something. Severe pain is, hey, we need to change something is not right. And then some levels of discomfort or lower levels of pain can be really helpful in saying, okay, we're a little unsure at this point, but then if we continue, symptoms may actually dissipate. And one of the things I wanted to kind of talk about some pain in particular, but is back spasms. So I get a lot of people who have back spasms, and I actually had one client who, was dealing with back spasms and, avoided a lot of rotation and a lot of movements that can sometimes set off these back spasms, because it put them out for the next few hours or maybe even the next day. And there can be some myths around back spasms too. So how do you kind of describe that and maybe approach back spasms?
Yeah. So spasms can come from a lot of different things. One, at a very basic level, it can just mean your tissues aren't super well hydrated. And so dialing in some of those nutrition things can be a big factor for decreasing that. The other thing is it can mean that your body is moving in a way that it maybe doesn't feel safe, or it doesn't feel predictable. And so when we are moving in ways that are kind of feeling unsafe, even if they're completely safe, our body might spasm to protect. So we'll see it often if you don't get a lot of that movement day to day, and then all of a sudden you have to move into that kind of quickly or unexpectedly. So my favorite way to prevent the back spasm is actually to encourage movement in more directions, more variety, kind of day to day in general. So we spend a ton of time as humans sitting with like a slightly forward slouch or kind of bending forward. We spend a lot of time in flexion. And so when you go quickly into any other range of motion, you can set off a little spasm cycle. But if we can train your body and brain that it is okay to move in those directions, which it is, then you're less likely to go into that protective mode because you've experienced it and your body knows it's safe. So doing things like sidestepping, moving side to side, lunges side to side, pickleball, sports movements that take you out of this direction and introduce more range of motion, different planes of motion, can be really, really helpful for mitigating some of the spasm stuff.
The variety is the key.
Yes.
The key to keep your body moving. And so it's not only important just for hips or knees, it's important for your entire body. And then I assume probably neck pain is going to be very similar as far as moving your arms and things in different directions. And if you're not doing sports, you may not reach your arm totally over your head all the time, and doing those things that your body then starts to become more comfortable with. And a lot of times I think there's a lot of fear around back spasms too, or this can probably apply to spasms really anywhere. But back pain in particular, I feel like anything that's like close to your spine can be kind of scary, especially, you know, when people don't have a background in exercise or things like that. So are back spasms typically dangerous?
No, absolutely not. Most of the time, a lot of times back spasms are actually a result of like you trying to overprotect too, right? If you think about a muscle that's already like turned on and tightened down to protect you, and then you have to move, our muscles were made to kind of elongate and contract and elongate and contract. And if they're kind of stuck in one way and they're not able to relax, you're going to not be able to move through that range of motion. And so sometimes decreasing fear or decreasing the anxiety around moving in a bunch of different directions is another thing that can kind of decrease the likelihood of a spasm. You being afraid of having a spasm is going to put you at a little bit higher risk for having a spasm because everything is going to tighten down to protect you. And so that's where graded exposure to stuff, gradually introducing things that are a little scary or a little out of your comfort zone can go a really long ways.
Sure, absolutely. And fear can play a big part in a lot of different movements, especially when it comes to the spine. And, you know, people are always afraid to, you know, make things worse and that sort of thing. And I think one of the things going into kind of that fear aspect is I just kind of want to touch on disc herniations a little bit, because I think there are some myths around, you know, whoa, you have a disc herniation, we need surgery to kind of put that back into place and things like that. So kind of what is maybe an approach to some disc herniations, and then we'll kind of talk more into like how to just keep your back healthy.
Awesome. Yeah. So first off, let's just bust a few myths about disc herniation.
Yes, love it. Okay.
One, your discs don't slip. Your discs are securely attached to your spine. You can have disc herniations and disc bulges, but they do not slip. And so that term is scary and it can elicit a lot of fear in people. So let's move out of that language because it's not really accurate. Two is people heal from disc herniations all the time. So often we'll see someone who has a herniation or a disc bulge have complete resolution of symptoms and complete return to activity and sport. And the cool thing about kind of where our research is pointing us right now is you have the same outcomes of surgical versus not surgical for disc herniations 1 year out. And so the surgery is not the only option. And oftentimes it's not even the correct option for most people. Conservative care is super effective at dealing with disc herniations. The other thing I always like to mention is just because you have a disc herniation on imaging does not necessarily mean that it is responsible for your back pain. So we see in research that if we took 100 people with backs, so 100 people, and 50 of those people had back pain and 50 of those people did not have back pain. In the category where people didn't have back pain, we would see a percentage of people who had disc herniations on images, but no symptoms to match that. On the flip side, we see in the back pain category, a bunch of people who have symptoms that look like disc herniations on evaluation, and they do not actually have disc herniations on imaging. So just because your image says it doesn't necessarily mean that that's what's driving your symptoms. So that's another myth to bust, is just because you get an MRI and it's like, I've got a disc herniation, doesn't necessarily mean that that's where your symptoms are coming from or what's driving your pain.
Sure.
Disc herniations, discs like movement. We, in order to have healthy discs and improve disc health, we need to get good fluid and nutrition into that, and we need good lubrication to those surfaces. And one of the ways that we do that is through movement. Again, in this scenario, not all movement is created equally. And so sometimes you're going to be more sensitive to other movements. And we, in those worlds, will often remove some of the irritating movements for a while, encourage some of the less irritating movements, and then bring those ones that were previously a little irritating back in and see how you tolerate them. Oftentimes, if we can just decrease the irritation, the inflammation, and then reintroduce stuff, you tolerate it very well.
So rest likely is not the only treatment
Yes.
for this, because a lot of times, I mean, this really can a lot of this conversation definitely applies to other joints as well. Like your cartilage loves movement as well. But it's a lot of the times it's, oh, I'll just stay off it, or I'll just kind of spend more time resting and hoping that the symptoms will decrease. And then if they don't, then it can lead into kind of some of this scary scenario of, it's not going away, I need surgery, etc.
Yeah. So rest is usually not indicated for back pain. We want people to move. We know that movement is important. We have good research to suggest that if we can get you moving again, your outcomes will be good. We used to, I think part of it is the physical therapy field has had a lot of growth in the last, 3 decades as far as what's a good method of treatment versus what's not. And back in the day, we used to put everybody on a table and you got a hot pack and a cold pack, and that was your PT. And turns out that wasn't super effective. And now we have research and evidence to show that, yeah, actually movement's what's going to help it back. And part of it is because of the anatomical structures. Things need, they need nutrition, and our body was built to deliver nutrition through movement pathways.
Yes, absolutely. And I want to kind of segue into now how to keep your back healthy, whether you currently have pain. And I mean, obviously, like we just mentioned, going through certain steps of finding movements that your body likes, and then we kind of follow that path. Once you're kind of at that path and maybe even preventing recurring back pain, what are maybe some of the things? And I want to kind of first talk about a little bit, is core strengthening or core stability the only treatment for back pain?
No. I'm so happy that people have attached onto this idea that like we need to be strong to be better with our bodies. But also there are so many things that contribute to back pain, and your core strength is not the only thing. I will never tell someone to not be strong in their core.
Never should. Core strengthening is always important.
Yeah. We'll never turn down a stronger body in any way that we can. But there are a lot of other things that that will give you more bang for your buck as far as decreasing your reoccurrence. And doing only core exercises is not the only answer. So one of the things that is interesting about a lot of the back pain I see is people come in and I ask them about their symptoms, and I ask them, okay, like, could you, like, what do you think led to this? And a lot of times people can start to feel or pick up on like, oh, like a couple days before, I always notice I get a little stiffer, or it feels like my back is like tightening up a little bit. And then I do something and that becomes really painful. And so one of the early warning signs for back pain is actually a little bit of a loss of mobility or loss of range of motion in your spine itself. And so one of the things I advocate for is having people do some kind of daily movement routine that you check in with the quality of that motion every day. So that could be as simple as when you bend forward to tie your shoes, or when you go to shower and reach behind and wash your hair, noticing how easy it is for you to bend and extend your spine, and how easy it is to kind of move side to side. If you notice that that is getting stiffer or tighter or more restricted, that could be an indication that maybe you're on a path to having a scenario that might cause you some pain. And maybe we need to introduce a little bit more movement into your life to kind of decrease some of that stiffness. The other one that I always recommend is, again, this variety of movement thing is so important for our spines and our spine health. People really demonize poor posture in the back pain world. And in reality, it's not actually how we sit that is the big factor. It's how much we sit, right? There's nothing inherently wrong with sitting slouched. There's nothing inherently good with sitting upright. But what we see is we just spend a lot of time sitting, right? And so if we, Yeah. Yeah.
Any position really.
Yeah. So if we can just increase movement in general, that's going to help our spine health tremendously. So, and again, there's something to be said for moving outside of your typical movement pattern. So if you sit on a computer all day for work and then your only exercise is to hop on your spin bike and do that for 30 minutes, great. Keep doing that. Don't cut that out, but add something else into the mix. Add something that's going to move your spine side to side or twist or rotate it. Our spine needs more than just this because we don't live just here, right? You go to unload your dishwasher or reach across, grab your bed sheets, anything. Those things require rotation. They require side bend from our spines. And if we're not getting that like frequently throughout the day, it's going to get stiff and then it can be painful.
Yeah, absolutely. And again, kind of that theme of variety, just moving in different ways. I mean, simply just like side bending. And I think that's where we get a lot of people who do feel better doing some sort of stretching or something,
Yep.
just because you're moving in that direction. So say like a child's pose where you're
Yeah,
kind of
like a yoga
back
class.
and then
Yeah.
reaching forward. I mean, that is kind of a bent forward position or elongated position we don't get in very often. We live in kind of this realm of being, in this small little circle of movement, especially, sitting and things all day. So there's not necessarily, and I like that you touched on the posture part, because there's not necessarily like a perfect posture. I even notice back pain sometimes after I've been sitting for a while or not moving, and it's not necessarily dangerous. It's again, our body just saying, hey, it's time to actually do something because you haven't listened to me in the past, couple of minutes or whatever it is. So I think that's really important. And are there any specific exercises that you really like or that you find yourself using pretty frequently?
I really like, I like to introduce lumbar extension, so back bends when they are appropriate for people, because that's opposite of what we typically get. So that could look like the form of like Supermans or press ups or kind of cobras in the yoga world. That could look like an overhead press, right? When we push stuff or pull stuff over our head, we get lumbar extension. I really like that for mobility. I also really like to address some of the stiffness, weakness, and restrictions in hips. So a healthy set of hips feeds off of a healthy set of spine and vice versa. So they influence each other's movements. And so if someone has really weak hips or if someone has really stiff hips, we'll try and introduce some exercises, some squats, some deadlifts, some sit to stands, things that are also going to work on hinging and movement from your hips.
Sure. And vice versa. I mean, if you have, a stiff back or something like that, then your hips may be taking more of the load. And also if you have hip osteoarthritis, it's so important to look at your back and continue to kind of add in some of those different movements to challenge your spine in different ways. So everything is moving how it should, because if something is stiff and something isn't moving how it should, it has to pull that mobility from somewhere else, which I think is very important to kind of realize that everything is connected, just like you were saying. So kind of a wrap up, if somebody is maybe experiencing back pain or neck pain, what are maybe the top one or two things to kind of think about right now to help set them up for success in the future?
Yeah. So first, I would say this. Deal with the low-hanging fruit. So are you getting enough sleep? How is your stress level? Are you doing something to mitigate stress, something to regulate your nervous system? Are you putting healthy, happy things in your body? Those little basic, not glamorous things make a big, big, big difference in your outcomes for pain, and your outcomes for strength, and your outcomes for mobility. So first off, if you don't know where to start with those. Okay. It doesn't matter what kind of symptoms you have, start with those. Second, I would say, see where your range of motion restrictions are. Can you bend forward as far as you normally can? Can you bend backwards as far as you can? Can you move side to side? If not, sometimes the place to start is with the deficit. So if you're really stiff moving backwards, sometimes that's an indication that we've got to start to get you moving backwards. If you're really stiff moving forward, sometimes that's an indication that we need to start to get you to move forward. And along with that, listening to your symptoms. So if you're getting increasing leg symptoms, increasing foot symptoms as you bend forward, that's probably not the best movement for you, because that's peripheralizing you. Again, when we have back pain or neck pain, especially things that are sending pain away from your spine, you got to do the things that make the limbs happy first and then your spine happy first. So just because it feels good in your back doesn't necessarily mean that's the right move if it's making your calf pain or your hamstring pain or your glute pain worse.
So it's all about, I like the idea of the low hanging fruit, because again, with osteoarthritis kind of anywhere, these things can impact your body. And it's not just for chronic pain. I mean, you can have more fatigue. It can impact your energy levels. I mean, it can impact a lot of different things and can actually impact your sensitivity to pain. And so I think that it's so important to look at some of those things, those lifestyle factors, like, oh, you know that you didn't eat very well yesterday. Well, that maybe could put you at a little higher sensitivity for pain, but we have to recognize these things, because I think a lot of times people go right to demonizing movement. You know, I moved a certain way, or I reached across and all of a sudden, you know, I felt some pain. We're very quick to demonize things, but it's hard to look internally, and it's hard to say, yeah, I'm making these choices and that could be why I'm experiencing more pain. So I think that that's important. So really, ultimately, it's adding that variety in and just experimenting with your body and moving different ways. That just because you have a back spasm doesn't particularly mean that something dangerous is going on, and that you can actually find some relief. So one last thing, if you could just give us maybe one, I'm going to put you on the spot, one like of your most powerful patient stories of patient recovery, or someone that did find success and, you know, is doing the things that they want to now.
Yeah. So I think some of the most profound patient stories that I have are people who've just dealt with stuff for forever, where it feels really hopeless. So I had a guy in here last week, actually, and he had back pain for the last 8.5 years. And he was on a horseback riding accident and had never been the same since. And we took a thorough history. We listened to him. He didn't have very many leg symptoms, but he had a lot of back pain, a lot of back spasm, and a lot of range of motion deficit. So he really felt like he wasn't safe to move in any direction. The things that helped with him were, one, like validating that, like, yeah, that was a scary thing that happened to him, and his back has been protecting him, which is great. We love that our bodies protect us, but then also talking about the difference between pain being a signal that something is dangerous and pain being a signal that something is unfamiliar. Hurt doesn't always equal harm, and so by helping him understand that first, then what we were able to do was explore some movements that he was terrified to do. So we actually had him start just doing little baby kind of back extensions. And he hadn't done that in like 8 years, because that was scary and painful and a really big no-no in his world. And after slowly observing, allowing his body to go through that movement pattern, all of a sudden his pain started to get better. And he started to recognize, like, oh, maybe some of these beliefs that I had about what my back was doing and how it was functioning, maybe those aren't true anymore. And so he, by the end of our session, was able to get through full range of motion of his back, which he hadn't done in 8 years. Yes. And then he stood up and he touched his toes for the first time in 8 years, and his back felt significantly better. And it wasn't any like magic thing that we had done, except for help him understand where his symptoms were coming from, what was likely contributing. And part of that was, it wasn't a whole bunch of structural stuff, right? His spine was fine. His back is strong and healthy. He is a young, vibrant human. And allowing him to recognize where that pain was a signal that was telling him, like, yeah, I haven't done this in a while, or this is stiff, or this is sore, versus like, this is dangerous. Those are very different. And he was able to work through some of those fears and move better. And he started riding his horse again, which I'm really excited about.
That is so
So
awesome. And
yeah,
what I really like about that story is that it wasn't, he tried some special like traction machine, or he was like moving in these crazy different ways, or was trying, these random supplements and things like that. It's really just movement. That sometimes all that other stuff is just ancillary, but a lot of times we're out there looking for the best new thing, the best treatment option that's going to get us results, but then end up without answers, or end up empty-handed a lot of the times, because sometimes it's just as simple as talking through things and being validated that your pain is real, and it may be a little bit overprotective, but these movements are safe, and that things aren't always dangerous. And that goes the same thing with osteoarthritis again in general, is sometimes that pain can be really scary, and we kind of always just kind of go right into, well, there must be something wrong, we must be doing more damage if we have that accompanying pain. So I think that's really awesome. And I think that's very powerful, just from the fact of it's not, we don't always need all these fancy things. And I'm sure at some point, he may have already gone through surgery after the accident, or surgery had crossed his mind along the way, but maybe he was looking to avoid it. And so just kind of finding the right professional, I think, can be a very important thing, and finding someone who's going to listen to you. If someone just dismisses you and just, which I'm sure that this gentleman had experienced, and tried to give you just all kinds of medications and other extrinsic things, that it can be really frustrating. And especially if you're dealing with pain for 8 years, 10 years, And so I think that that's really powerful. So that's very awesome. And then if somebody wants to find out more about you, if they're listening and locally are here in Utah, or just want to find out more information about what you have to share, where can they find you?
Yeah, so I have a website, so www.pinionpt.com. And then you can find me on Instagram. I share some gems there. My handle is at Dr. Sarah Mcnurlin, _DPT.
I'll put it in the link. So if you're watching the video, it'll be down below. And if you're in the podcast, or if you're on the podcast, you can check it in the show notes. And she definitely shares some amazing information. And so if you're sitting in there struggling with back pain, or struggling in which direction to turn, then Sarah is a great resource to follow. I just want to thank you so much. And this was an awesome episode. And I just want to thank you for sharing your time with us.
You're welcome. Thank you.
All right.